Здравствуйте, меня нет дома. Оставьте, пожалуйста, месседж. До свидания, спасибо. Здравствуйте, меня нет дома. Оставьте, пожалуйста, месседж. До свидания, спасибо.
А я что-то еще и не верю, что я там какие диагнозы поставили страшные. Кто будет, то будет. Вот и все. Конечно, уже 92, что может быть, уж не может.
Good evening, Cambridge viewers, and welcome to Women Speak, the women's show here on Cambridge Live Cable TV. My name is Tess Ewing, and I am your host the first Wednesday of every month when we talk about issues of women and work. My guest today, I'm very happy to say, is Donna Kelly-Williams, who is the president of the Massachusetts Nurses Association. And actually, she's a Cambridge nurse. She's been a Cambridge nurse for a long time.
Over 40 years.
Over 40 years, okay. And she still is.
Still is.
She's also the president of the Nurses Union, so that's a lot of work. So welcome, Donna.
Thank you. Thank you, Tess.
Very happy to have you on the show. Well, we had a couple of members of your union on, a couple of actually local officers on a few months ago when we talked about the strike that they had, the one-day strike. But this time we're talking about not so much a defensive action, but something going forward that will protect both women workers, i.e. nurses, and for that matter, the patients. So this affects us in two times, as consumers and as workers. So
absolutely.
What I invited Donna here to talk about was a piece of legislation that they are working on. Actually, I found out that there's 3 pieces of legislation that they're working on, so we'll take them all up. But what originally I thought about inviting Donna to talk about is something called the Patient Safety Act, which is an initiative petition, and they're out collecting ballot signatures right now. So first off, Donna, would you tell us something about what is the petition about? What are you trying to accomplish with this piece of legislation if it passes? And then after that, we'll talk a little bit about the campaign. But
Great.
What is the legislation? Why is there a need for it, and what will it do to address that need?
So the ballot initiative is different than the other 2 pieces of legislation that we filed. And what this involves is, first of all, it's to set a safe limit to the number of patients that are assigned to a registered nurse at one time in the hospital. So that when you are in the hospital, that you are not sharing your nurse with so many other patients that your care needs are not being met.
Right.
So as nurses, we want to be able to take care of our patients in the most optimal way.
Of course.
But if we're stretched too thin, the patients are the ones that suffer in the long run. So what this will do is it will set a safe limit to the number of patients at one time in all areas within the facility. So a few years ago when we did this ballot initiative, we were successful in not going to all of the units, but certainly setting a limit to the number of patients in the intensive care units.
Okay, that would be really important.
They
Obviously.
represent over 40% of the beds in the Commonwealth.
Is that
and
right?
those are the
40%
sickest.
are in intensive care.
They are the sickest of all of the patients. And
They
that
pretty much need constant
monitoring. And that also includes the burn intensive care units, the cardiac intensive care units, the pediatric intensive care units, neonatal intensive care units. So all of those are encompassed in that. And that law is very specific, that was passed in 2014, so that there is a limit of 1 patient to 1 nurse in the intensive care unit. However, if that patient is deemed to be stable enough by the nurse's assessment, then the nurse can say, I can care for a second stable patient. But at no time should any nurse in an intensive care unit have more than 2 patients at any
Okay.
time.
And
So-
more than one if they're unstable.
And more than one
If
if
there's
they're
unstable, they can
unstable.
only have one.
Correct,
Right.
correct. And at that time, we said that we would be back for the other units. And we did file legislation the next legislative session. And because it was not put into law for the other units, we are now going directly to the ballot, directly to the voters to say that we want to be able to provide the safest care possible to you while you're in the hospital. And that is why we need a limit to the number of patients that
Sure.
are signed.
So, several years ago when the ICU patient limit was set, did you push for that legislation at that time?
Yes,
Or-
we did. Yes,
And
we did.
Did you decide to just go for ICU, or was that a compromise?
It was a
in the list?
compromise. It was a compromise at the very end.
Because I thought I remembered that you folks were pushing for patients,
We have been
patient limits for
working
quite a
on
long
this
time.
for almost 20 years.
Yeah, just
almost
like-
20 years. And we felt that because those are the sickest patients, those requiring intensive care, that it was a step in the right direction and a first step
Yeah.
to seeing those safe limits applied to all of the other units. And that's why we said we will compromise and limit it to the intensive care unit at this time.
And
But
now
we will go forward with making sure that all patients in all hospitals will
So,
be cared
so
for
this
safely.
is, we're at that point now.
We are.
Right.
We are.
So, but tell me a little bit more about the need. I mean, I would think it's in the hospital's interest as well to not have their patients dying. That would be pretty poor planning on the hospitals.
Right.
Even if they're like nothing but greedy jerks, they would not want their patients to die. So it's got to be in their interest to have adequate staffing.
Exactly.
And do they not? Is it a problem? Is there
It
real
is a problem. And some hospitals are better at staffing than others.
Okay.
But as you mentioned, you had nurses here from colleagues from Boston Hospital that
Yes,
were here,
yeah.
that were out on strike for
Yeah.
the very reason that
That was one of the
staffing-
reasons they were.
That was
they were
the
striking.
primary reason.
Oh, okay.
The primary reason. And for the hospitals that have gotten to the point where the nurses don't have any choice but to let the public know that there is a real safety concern within particular facilities.
It's got to be really tough.
Mm-hmm.
If you get assigned too many patients, what do? You can't.
You do the very best
You just
that
have to do what you can.
You can
Yeah.
you do what you can, but oftentimes you leave feeling like you have not done the best that you could do.
Sure.
You could not
Sure.
do all the things that you were trained and as a nurse to be able to do to make somebody's pain a little bit more tolerable. Just being able to be there with the patient or even getting them up to go to the bathroom in a timely way.
Yeah.
So that
yeah.
when they put the light on that they need something and the only reason you're in the hospital is because you need continuous nursing care, there needs to be someone to respond.
Someone to respond to the button right away.
quickly.
Yeah.
Right.
Yeah, because it could be an emergency.
And you know yourself, Tess, that what we've seen is a speed up of hospital admissions. As soon as you're in, there's a plan.
Oh,
for
yeah,
where
you're in and
gonna
then you're
go.
out.
You're in, then you're out.
So I hadn't really thought about that, but that business of, it used to be that you would, after an operation, you'd stay a week in the hospital, right? Or even after giving birth, you'd stay, I don't know.
Used to
Quite a
be,
while.
Used to be a couple of days.
Yeah,
It's
well-
2 days and you're out.
Now it's, you're gone.
And in
so
that-
what that implies is that you're sicker when you're in there. They're
Absolutely.
not patients who are just convalescing who would need less care the way it used to be in the old days. Now
Right.
everybody who's in there pretty
Mm-hmm.
much needs.
And the preparation for you to be able to transition from being in the hospital to being able to go home involves a lot of teaching. We have to teach the patients how the post-operative care or the post-delivery care is, or the care for the baby going home, how to administer medication. There's also the
How to
making
change your
sure
dressings, how
the
to-
dressing, arranging for the visiting nurses to come in and see you, and making sure that when you're discharged from the hospital, that you are going home, that somebody is going to be looking out for you, and that you have food in the refrigerator, and that you're able to manipulate the stairs and be able to use the bathroom when you need to. So if you can't do those things, we need to make sure all of those things are in place before you go home. And if that's rushed through and you don't have a clear understanding of all of those things, you're the patient that's going to come back and be readmitted in 2 days. So that's the concern that we have, is that we want to have you cared for in the most optimal way. And what we've seen is this is needed in, there needs to be a limit in every hospital. And also built into that is the flexibility that there are, in that it is by specialty areas, so it's not a one size
I was
fits
just going to
all.
ask you about that, because obviously, you know, there's different levels of need. And so
a new
how do you-
mom versus somebody who's in active labor.
Yeah.
It's all written out in the ballot initiative on what those are, and it's based on the most recent research that we could possibly find, as well as specialty organizations that have put in place guidelines for the best care that we can give to the patients. Those are the things that we incorporated into this, as well as leaving opportunity for flexibility so that if a patient needs more care, they can certainly be given that additional care that they need.
So, okay, so it's not one size fits all. You have
Not at all.
different numbers of nurses for different.
different times,
for
different
example?
acuity.
Yeah.
For example, if you go in to have a baby,
Yeah.
the guidelines are if you're in early
I
labor.
probably won't at this point in my life.
I'm not
Probably
either,
not.
but
Yeah.
but that's what I do now. So
Yeah, oh,
if I'm
okay.
taking care of you and you're in the early stages of labor, I may not only have you, but I might have another patient
Okay,
during
yeah.
that early phase. But when you are getting closer to delivery, ideally, you need to have one nurse
nurse.
caring for you. And at the time of your delivery, the guidelines are very clear that there has to be another nurse there who exclusively is there to take care of the baby.
Got it.
That has all of that additional training to be able to care for that baby if the baby needs a little help getting started.
Okay, so you have like a,
Just different provisions.
Different- yeah.
Yes, for different levels of care.
and they range from, I saw in the summary of the legislation that in some cases it's one patient per nurse.
Yes.
We've been talking about some of them, and then it goes down to, I think, in a psychiatric ward, it could be five patients per nurse,
right.
But, okay, so let's take sort of an average medical floor, say, and it would be what, for?
1 to 4.
1 to 4, so 4 patients per nurse. And let's say there's 2 medical floors on a given hospital. I'm just making this up.
Sure.
And so each one has 4 nurses. Now, on a given night, everything could be quiet on one floor, and then the other floor's got like 3 emergencies happening. Can some of the nurses from the quiet floor come down and help out on the not so
So
quiet
Tess,
floor?
being a night nurse for almost all of my career, I can
Ah,
tell
yes.
you that the nights are not quiet. When
Okay.
patients are in the hospital today, they need 24-hour
Sure,
nursing care.
okay.
So there is no quiet time there. So if you have nurses that are assigned to 4 patients,
Yeah.
there's certainly opportunities for 2 nurses caring for 8 patients together can help each other out.
Okay.
But that is the safest number based on all of the
Okay.
research. So every patient above 4, there's an increased risk of morbidity or mortality of 7%, and that's compounded.
7% per.
Per.
Oh, but
So if I
compounded.
have 4 patients,
Yeah.
but now I have 5, their risk of having a complication goes up by 7%.
Right.
If I now have 6 patients, that risk now goes up to 14%.
Right.
And additionally compounded as it
Yeah.
goes up.
Yeah. Yeah, so this is serious stuff.
It is serious stuff.
Yeah.
It is.
So, there must be pushback, because otherwise you would have passed the thing for all the nurses 4 years ago. So obviously somebody doesn't think this is a good idea. Let me guess, maybe it's the hospitals?
Correct?
And so why, what are their arguments?
And I think that we've addressed them in all that we've done. We've done a lot of homework on this.
Okay.
So one of the arguments that they had was that we need flexibility.
Sure.
We
Now,
have
you've been
made
talking about
sure
flexibility on your
that there
side.
is flexibility in there. But at the same time that there's flexibility, there also needs to be a limit. So
Okay.
if I have a limit of 4 patients on a medical surgical unit, but my patients are sicker or they require different resources in order to care for them, that 4 is really too much, I can certainly be assigned 3 patients.
Sure.
Absolutely, or 2 patients.
Well, that's the
if it
thing about
warrants.
a limit. A limit is the
Right.
floor, and then you can.
Exactly.
Change from there,
And it's
but-
based on the needs of the patient.
But the problem is, where does? Okay, you got 4 and they're too sick, so you really only have 3. But who's going to take care of number 4?
The other nurse.
Yeah, but she's got 4 too.
No. You make sure that you have the staffing
You have enough.
to be able to do that.
And can't that be tough for the people who are setting up staffing schedules? How do they know?
They don't know, but there are opportunities and there are ways that it's done in some facilities right now.
Okay.
You have resource nurses or you have per diem nurses. Or
Resource
you have
nurses, or this something like
resource-
floater type
yes,
of situation where they
yeah.
can, yeah.
And resource nurses in some of the facilities are actually critical care nurses that are able to come in when you have
Oh, that's right.
the Tufts nurses
The Tufts
talked
nurses
about
would
that.
talk about resource
exactly.
nurses, yes.
They're critical to
Yeah.
the patients that are on a general medical surgical floor that develops a complication and needs a higher level of care, to have that nurse who has those skills be able to come and assess that patient and transition that patient into a higher level of care.
Yeah. Uh-huh.
Yeah.
Okay. Or you can get per diem nurses, you said.
Yeah, you can call in more per diem nurses.
And it's, typically, is that something you can do on the drop of a hat? You can just make a
Well,
call and the
you-
nurse comes in?
You know,
Yeah.
for example, the charge nurse on a unit. So every nurse, every floor during the shift has a nurse that's in charge.
Sure.
If you either not assign patients to that charge nurse or you limit the number of patients that are assigned to that charge nurse, you have built-in flexibility to be able to help when you have a patient that requires a different level of care.
Got it. Yeah. So, tell me a little bit about the campaign. Several years ago, you introduced legislation, or you did a ballot initiative, I don't know which.
Both.
And both, and you ended up with a compromise that only covered certain people. So you went back to the drawing boards, you did a bunch of research, you said, and you
More research.
and you made some changes in what you're asking for, right? To
Still
deal
a
with-
safe limit to the number of patients.
safe limit to the number of patients, but you also wanted to address some of the concerns that the
The
hospitals
hospital, absolutely.
brought up. And now you have this new one, and you are collecting signatures right now.
Correct. So the process now is until November 23rd, we're collecting over 100,000 signatures.
Okay.
And at the same time informing people who are our potential patients or
Right.
who have been patients of what the complexity of nursing is right now and why this is so needed right now for nurses to be able to care for their patients. So that's where we're at right now.
Yeah, we've come a long way from Florence Nightingale.
Yeah, it's very
She
complicated.
was a great
now.
woman.
Absolutely, absolutely.
Nurses today
It's a very
know an awful lot.
it's very complex
Yes.
with all of the medications and the technology that we're dealing with right now. So we have done our homework on that, and that's why we're back out collecting those signatures. So once we have that done, the signatures have to be certified in each of the individual cities and towns.
Right, and you
that
need from every
every city
city
and
or
town.
you need to
right.
have signatures.
You have to have a representation of all of the people in the Commonwealth of Massachusetts. So that's where we're at right now, and we're just about at our goal. And once we submit those to the Secretary of State,
You have almost as many as you need.
yes, we
Okay.
do. We're,
All right.
we're still
for
working
you.
on
Yeah.
getting more because we want to make sure that we have more than what
You
we
need more than what you need. Yeah.
just to make sure that we can get this over the finish line, but also to use this as an opportunity for people to understand why this is so
Why
important.
is it so important? Yeah, yeah.
Yeah.
Now this only covers hospitals, right? Does it?
Right now,
does it-
yes, yes.
I'm not
You
sure.
have to start somewhere,
Of
just
course
as
you
we
do,
did
yeah.
with the intensive care unit. But there has to be a limit to the number
Yeah.
of patients.
Okay, that makes a lot of sense.
Yeah.
Okay, so you're gonna submit these,
Right, and somewhere
this
in
month?
we'll
and then-
submit them,
In
probably
January,
the first week in
the legislature
December.
will take it up?
Yeah, we'll have a hearing, there'll be a public hearing.
Okay.
That'll take place in January, and then following that, for the next phase of it, we'll have to collect approximately another 20 to 25,000 signatures again. There's a second
Why do you
phase
have
of
to
the
do it
ballot.
again if you've already done it?
It's just part of the process of
Okay.
having a ballot initiative, and
Okay.
those are the laws of the Commonwealth in order to move this forward.
So then you expect it to be on the November
Right.
2018 ballot, so everybody watch out for it and vote yes when it comes
Yes,
up.
definitely, definitely.
Patient Safety Act, yeah.
Yes.
So also, before I ask you anything about the other two bills that you're talking about, I just want to bring people's attention. Here is the website of the Patient Safety Act and or whatever it's called, Patient Safety Act bill, and the web.
And you can go directly to the Mass Nurses website.
Okay.
Also, it's www.massnurses.org, and
Got
there's a
that.
link that will go right to the Safe Patient.
And this
Units.
is this website here is www.patientsafetyact.com, all one word. So you can find out more about it there, including probably how can I help. It's right up there on the right hand side. So that's that. And now let's use these last few minutes to talk about your two other pieces of legislation, which in this case, they're not ballot initiatives, they're actually being taken up by the legislature.
Correct.
So would you tell
Sure.
us what they are?
The first one is workplace violence prevention.
Okay.
And what this bill actually does is it requires all healthcare facilities to do a risk assessment to look at areas where you can decrease the risk for workplace violence, and also to put into place things as simple as locking doors after visiting hours,
Yep.
identifying who's coming into the building, as well as having response teams when a healthcare provider pushes a button that says that we're in trouble here or we need assistance, that there is an actual response.
Is this a big problem in hospitals?
It's increasingly
violence.
a more dangerous area.
Yeah.
Yes, nurses and other healthcare professionals are assaulted more than police officers and corrections
Really?
officers. Yes, and
Wow, more than corrections.
absolutely.
That's quite amazing.
Yeah, and I think too, Tess, it goes to the frustration that people have of not being able to access healthcare, and
Sure.
the frustration that they feel of not having the time with the providers that are trying to take care of them. So there's a combination of things that are leading to this increase in workplace violence. But we also want to protect the person that's a victim of workplace violence.
Of course.
So also, in addition, in the bill, it also allows for that person to have paid time off to be able to go through the court systems or go to for counseling or whatever
Oh, okay.
physical needs
Yeah.
that they might have.
That sounds like a really useful thing then.
Yeah, and
Yeah.
the legislator is looking at it very
Okay.
favorably, so we're hoping that will be
Okay.
passed within the next year.
Okay. Will you be lobbying for
Oh
it?
yes, I was up there this afternoon.
Okay.
So we
Okay,
make sure that we're
but-
up there to be available to answer any questions that any of the legislators might have about
Sure.
what this means, what we're seeing. And I think that's important because I think more and more people don't understand the complexity of nursing
I
and
think that's
working in the
true.
hospital.
Yeah.
And they've been very receptive to hearing what we have to say and also inviting us in to talk to them, to update them.
So are our Cambridge legislators on board with these bills?
Absolutely, they are.
Okay, so we don't have to lobby our
You don't.
our
They've
Cambridge
been
folks.
very helpful.
Yeah,
Rep.
we're
Decker
the
has
best.
been with us all the way,
Okay.
and Representative Conley has been
Can't say
terrific.
that I'm surprised. Okay.
Yes, they've been very supportive.
So okay, and you got one more.
Safe patient handling,
Okay.
which again, it's an assessment by facilities to ensure that the proper resources are available for the safe transfer of patients.
So this is like when you say a patient needs to get up out of his bed and go to the bathroom or go to X-ray or something
Just
else,
even into the wheelchair.
you have to get him into the wheelchair. Yeah.
Correct. And we want to decrease the injury to the patient and the injury to the
yes.
healthcare person that's actually providing that care.
If anybody has ever tried to lift a heavy person out of bed, I had to when my father was sick. It's tough.
It can be very difficult, but there are resources out there, and our ask is that each facility do an assessment and to look for areas that you can decrease the harm that could occur to a patient and to the staff.
Okay.
Yeah, so they're both looking good.
They're both, and Cambridge legislators on board with this one too?
Absolutely.
Of
They have
course.
been incredibly supportive. Yes.
That's good.
Yeah.
Okay. So we hope that these will be made into law this year.
We're hoping.
Very, very hopefully. And the other one, we just, we'll
go forward.
We'll probably be voting on it in the
We'll
fall.
be out everywhere. You'll
Yeah.
see nurses everywhere that will be out there not only collecting signatures but also opening up the opportunity for anyone to ask questions about it and to learn more about what we want to do to be able to safely care for our patients.
That's really great. I don't suppose you have a Cambridge petition with you, do you?
Actually, I
Because
do.
I haven't signed it yet.
I
and
would
will
love for
sign
you
it
to
right now.
sign it. I have it right here for you.
Oh, excellent.
And I even brought a pen for you, Tess. There we go.
All right.
Yeah.
I wonder if anybody else around the studio has signed it yet. When we finish here, we'll go and
That'll be great.
see if the people who work here have done it. Okay, here we go. This is me.
And even collecting the signatures, most people that as soon as we say we're a nurse and we're here to collect signatures for a ballot initiative to keep our patients safe.
How can
that's
you be
pretty
against
much,
that?
Pretty much all we have to say, and they
Yeah.
say, where do I sign?
Does it say Cambridge on